All right, so now I'm going to show the hip going off axis into internal rotation. So when the hip goes into internal rotation in the efficient state, it should purely spin or relatively move posteriorly. If it's moving relatively anteriorly, then that would be dysfunctional, okay? I've already assessed K with this. Her right side's worse than her left, but for the purpose of this video, we're just gonna do the left side. So what I have here are half foam rolls positioned underneath the front of her hips. Ideally, not under her pelvis, so not ASIS, AIIS area, but just below that into just in the front of her hips, okay? So that way we're blocking the hips relatively, and I have them on both sides just to kind of equal, just for symmetry purposes before we start the mobilization. Now, again, I bring her knee up into 90 degrees. I want to kind of stabilize her pelvis, and then I take her into internal rotation, and right about there, I feel like she starts to run out of motion, okay? So the mobilization here could be hold here, Kay, don't let me move you. Now we're using that foam roll to block that anterior translation of the front of the hip. And slowly let me win. Good, we got a little more motion there, and hold here. And slowly let me win, okay? Now, let's say we're at the end of that mobilization. Now I would say, Kay, can you keep your foot out just where it is, exactly where it is? I come to the other side, turn on those internal rotators, keep it there. That's really hard for her. So I'm not really adding a lot of resistance here at all. I'm just almost purely tractioning. This is hard for a lot of people. We lose our ability to get the muscles activated at that in-range motion. And then slowly let me move you. Good, now you win. Push me out, push me out, push me out. Traction, traction, and hold. And I can do that a few times until I feel like she has a really good contraction there into internal rotation. So this is the first option on how to work into keeping the hip on axis into internal rotation. The second option is to use a belt. With the belt, I feel like you can really block the front of the hip a bit better. So, okay, go ahead and raise up, right there. Good. She's gonna help me position it. So you don't want it to be pinchy on the front of the hip. That's kind of a big thing with this. So I'm gonna come under here, and then I'm gonna tighten that belt down a little bit more so that I have a little bit of a block, and essentially I'm right on the front of the hip. I go to stand up a little bit, that blocks the front of the hip. I'm still stabilizing at her sacrum here, just to make sure the pelvis isn't doing any excessive motions. Now I take the hip into internal rotation to there, okay? So now I have everything locked out. So hold here, Kay, don't let me move you. Good, and slowly let me win. Good, so I'm just continuing to block the hip anteriorly. It feels like I need to give a little bit more, and then hold there, okay? Good, and let it go, and relax. So then I could go through the same re-education there as well. But that's just another option with the belt.